Thank you, Mr. Chairman. As a physician and member of Congress, I believe that every American should feel safe in obtaining medical treatment without worrying about facing discrimination based on his or her ethnicity, religion, personal convictions, or other arbitrary factors. Unfortunately, many Jewish patients now confront the troubling reality that anti-Semitic attitudes exist within parts of the medical community. Major medical organizations have permitted anti-Semitism to infiltrate healthcare settings, undermining confidence in patient care and weakening public trust. According to a recent peer-reviewed study published in the Journal of General Internal Medicine, 40% of Jewish healthcare professionals reported experiencing anti-Semitism in their professional or academic environment in the years after Hamas's September 7th terrorist attack against Israel, which is truly alarming. No physician, therapist, medical student, or healthcare worker should face intimidation or harassment simply for being Jewish. One recent example, which is deeply disturbing, was a protest outside Massachusetts General Hospital. Eyewitnesses reported seeing posters developed by the Committee of Interns and Residents depicting bloody raised hands alongside anti-Israel messaging. And of course, this is a reference to the 2000 Ramallah lynching of 2 Israelis, where one of the killers notoriously held up his blood-soaked hands to a cheering crowd. CIR is the largest house staff union in the United States, representing more than 40,000 resident physicians and fellows across 60 hospitals. Ms. Sheckman, you are CEO of the American Jewish Medical Association, which was created in response to rising anti-Semitism in healthcare settings after the October 7th Hamas attacks. From your experience, what do you think can be done when major medical associations defend leaders who engage in anti-Semitic harassment or excuse acts of terror?
Thank you for that question. It's an important question. I think what we also have to understand is that this piece of it is called institutionalizing of anti-Semitism. So when it enters into the institutions and it codifies it, then you're entering into dangerous grounds. It becomes systemic, and it's something that we have seen previously in history. There are a number of different actions that can be taken. Members can speak up. There are committees for ethics. There are reviews. It can be elevated as well into outside condemnation, and then it can go all the way up into civil rights actions, because these are Title VI and Title VII discriminatory actions.
No, thank you for that answer. And could you share some examples of medical institutions that have taken action against anti-Semitism?
I love that question. I think it's worthy of also sharing systems that have done well. We're working with a system, we're working with UC San Diego, who had some issues of their own, and we've been developing a curriculum with them that has been enlightening. I've gone to every single session of them, and as things have come up, there have been discussions in order to address them. I can also say locally, from the state of Connecticut, we've worked very well with our own, healthcare system there and Hartford Healthcare. They have been able to walk a very nice line and promote, say Israeli technology, innovation, and those that are really bringing forth partnerships and healthcare.
Well, thank you for your answer. And I'd like to yield the balance of my time to the chairman of the full committee, Chairman Walberg.